Hey everyone, we've got another heart today. This is number 690 in our collection. The heart would have sat in the chest roughly like this. Superior, the head would have been here. Inferior legs here, left here, right here, anterior surface coming out towards the camera, and then the posterior surface towards the turntable. As usual, we'll find the right atrial appendage, at least what looks to be it externally. And here we find an appendage that's triangular, broad-based, and pyramidal in shape. So we'll go ahead and open it there. And when we go ahead and open this atrium, we find that there are pectinate muscles that spill outside the confines of the appendage, consistent with the morphologic right atrium. Then we go ahead and find the oval fossa here, and we can see that there is, in fact, a defect in the oval fossa, so there is an oval fossa type intraatrial communication. And then we also find the mouth of the coronary sinus here. Let me try to demonstrate that a little better. So here's the mouth of the coronary sinus. And remember that the mouth of the coronary sinus is going to be an important landmark in the triangle of Koch. So the triangle of Koch is going to be delineated by the mouth of the coronary sinus, the tendon of Totaro, and the tricuspid valve's hinge point here. And at the apex of this triangle is where we expect the atrioventricular node to sit. Now, when we take a look at this right-sided atrioventricular junction, we do find that it is guarded by a valve that has 3 leaflets, and that these leaflets do have a septal connection, consistent with the morphologic tricuspid valve. This valve leads into a ventricle that has coarse trabeculations and has a septomarginal trabeculation here, consistent with the morphologic right ventricle. Now, when we get into the right ventricular outflow tract here, we find that there is a narrowing at the level of the outflow tract. And here we find the pulmonary valve, which is right here, has a very small pinpoint opening at its tip. So severe or critical pulmonary stenosis with intact ventricular septum. And so once again, here is the pulmonary valve here. We are looking down at it now, and you can see a small pinpoint opening which serves as the valvar orifice. The pulmonary trunk itself seems to be of pretty good size, and we see that there is, in fact, a left and a right branch pulmonary artery of good sizes as well. So, once again, here is the right ventricle, intact. Here is the septomarginal trabeculation with its cranial and caudal limbs. Then as we get to the RV outflow tract, we can see the valve, and we are looking down on the valve here, and you can see really looks like a single leaflet, and there is a pinpoint opening at its very tip right here. Now if we go to the posterior aspect of this heart, we do find a smooth-walled atrium consistent with the morphologic left atrium. Here you can now see the oval fossa once again, and you can see the intraatrial communication in the oval fossa. This is the mouth of the left atrial appendage, and you can see that the pectinate muscles are all confined within the atrial appendage itself, consistent with the morphologic left atrium. The left-sided atrioventricular junction is guarded by a 2-leaflet valve here that does not have any connections to the ventricular septum here, consistent with a morphologic mitral valve. With this being a morphologic mitral valve and having already seen the right ventricle, we would assume that this is going to be a morphologic left ventricle, and we find fine crisscross trabeculations here, consistent with that. As we get into the left ventricular outflow tract, we find a semilunar valve with 3 leaflets, 1, 2, 3, and 3 sinuses. So 1 sinus here, 2nd sinus here, 3rd sinus here, and you can see there is a coronary artery arising from this sinus as well, consistent with a morphologic aortic valve, and then here is the ascending aorta. As always, or as we usually see, I should say, not as always, there is continuity between there's fibrous continuity between the aortic valve leaflets and the anterior leaflet of the mitral valve. And we can also see the semilunar nature of the aortic valve, where there is no true annulus, because the annulus would actually be kind of this crown-shaped. And here are the fibrous valve leaflets with these triangles of tissue between the valve leaflets themselves. So a heart with pulmonary stenosis and intact ventricular septum. And there's that pulmonary valve with the pinpoint orifice once again.